Now in the news, we have Dr. Lestrange to talk about osteoporosis. Hello, Dr. Lestrange. Thanks for having me here. Osteoporosis is a bone disease that affects 2 million Canadians. It gives low bone mass and deteriorates bone tissue, which leads to a higher risk of fractures. It is common in those who are 50 years or older. So, Dr. Lestrange, osteoporosis is a deficiency of calcium? Yes, it is a deficiency of calcium, but it is also important to have enough vitamin D as well to prevent it. As we know, calcium helps the bones repair themselves when we use them every day. As we age, calcium is absorbed less effectively. This is why vitamin D is important as well. It increases the calcium intake that you're able to have. Having enough calcium can slow bone loss and reduce the risk of getting a fracture. How much do we need to have per day? That all depends on the person. Let's talk about vitamin D first. Since vitamin D is absorbed through our skin, the amount factors with where you live, how dark your skin is, and the time of day you are outside. Sunnier times will provide more vitamin D, while during the winter, less is absorbed. But that's all pretty generic. It should also be noted that having too much sun can lead to diseases like skin cancer, so it is recommended you protect yourself with layers of clothes and sunscreen if you're going to go out in the sun. Unit-wise, people up to 70 years old should have 600 IU of vitamin D per day. People above the age of 71 should have 800 IU of vitamin D. The increase makes sense once you remember that as we age, the absorption of calcium lessens, which means that we need more of the nutrient for healthy bones. We can talk about the rich foods that have it later. Calcium is different from vitamin D since it can only be received from food. Our body does not actually produce it naturally. A healthy adult between the ages of 19 and 50 will need 1,000 milligrams of calcium every day. That includes pregnant and breastfeeding women. Those over 50 will need 1,200 milligrams of calcium. The reasoning behind this is the same as previously mentioned. You mentioned taking specific foods for vitamin D. Can you elaborate on that? Normally, you would not have to focus too much on that, since there are no vitamin D levels that provide optimal health. However, if you have less than 20 nanograms per milliliter, that does require treatment. Treatment consists of trying to get more of that nutrient into the diet. Fatty foods such as fatty fish, beef liver, cheese, and egg yolks are great sources. What can cause this vitamin deficiency? Not spending enough time in the sun, not eating milk products or alternatives, and following a vegan lifestyle. All this means is that you aren't getting the recommended levels. Some other causes can be due to having darker skin, given that the pigment melanin reduces the ability to make vitamin D. Also, you can have your kidneys or digestive tract unable to absorb and convert vitamin D. How would that look like? The symptoms are subtle, but not having enough vitamin D can pose some effects such as cancer, severe asthma in children, and cognitive impairment in adults. Talking more specifically about osteoporosis, what is there to look out for and what causes it? Normally, symptoms for osteoporosis are subtle as well, and it can happen over a few years without any symptoms. It is dubbed the silent thief for a reason. Once the bones break and fracture, then the disease is already advanced. Some fractures can be undetected since they also cannot cause any symptoms. People are unaware of having the disease until they get a really painful one. Some common places where the bone fractures are the hip, spine, wrist, and shoulder. There would be pain depending on the location on which the fracture was received. People with it have a reduced quality of life, lower self-esteem, reduction or loss of mobility, disfigurement, a lack of independence, and in some cases death. 28% of women and 37% of men who suffer a hip fracture will die in the following year. Speaking more about the causes, there are no known ones to this day. However, there are risks and factors to take into consideration to see how likely you are to get it. These include cigarette smoking, excessive alcohol consumption, lack of exercise, having a diet low in calcium, malabsorption, and a poor nutrition and general health. What can you do to treat and prevent it? Firstly, it is important not to self-treat with supplements without your doctor's approval, since it can lead to toxicity and kidney stones. The supplements are available in liquid, tablet, and chewable forms. There are 3 main types that can be given: calcium carbonate, calcium citrate, and calcium phosphate. Calcium carbonate is the least expensive and has the most calcium. Calcium citrate is easily absorbed, and calcium phosphate does not cause constipation and is also easily absorbed. You should always talk to your doctor about taking supplements, since some medications can react poorly with them. There are even some cases when the diet and exercises aren't enough, in which case your doctor would give you regular injections to regulate the calcium levels. All of this can, of course, be prevented by eating enough calcium in your diet every day. It should also be noted that some foods that are high in calcium can also be high in saturated and trans fat. Choosing low-fat or fat-free options can reduce the risk of cholesterol. Canada's Food Guide recommends 3 servings of milk and alternatives, which include yogurt, cheese, puddings, and almonds. You should also lead a healthy lifestyle, meaning you should just keep a healthy body weight, exercise regularly, and restrict tobacco and alcohol intake. Just keeping overall healthy and eating the right amounts of calcium should do the trick, right? Unfortunately, there are some people who are more prone to getting osteoporosis. These factors include being female, being Caucasian or Asian, having a thin and small body frame, having a family history of osteoporosis, and having a personal history of a fracture. However, just because you aren't at risk doesn't mean you won't get it. You should always make sure to stay healthy so you can prevent different diseases and illnesses. Thank you so much for coming on today to speak with me. Thank you so much for having me.